Hello dear friends, welcome back. Let us see about the pubic bone, the parts of the pubic bone, right? So first of all, my dear friends, this is a hip bone, and you know that the hip bone is made up of how many bones? Three bones: the iliac bone, the pubic bone, and the ischial bone, right? The iliac bone is present superiorly, right? The pubic bone is present anterior-inferiorly, and the ischial bone is present posterior-inferiorly or inferior-posteriorly, right? So okay, so we are holding this bone in our hand, right? And this is a left hip bone, right? So this is acetabular fossa or acetabulum. It should be pointed laterally, and the pubic bone should be pointing anteriorly. So we say this is pubic bone. Now, as in the theory, I told you that the pubic bone has three important parts, right? What are those? The first one, the body, the superior ramus and the inferior ramus. Now let me show you here. From here we say that, okay, here we say up to here, this is the body of the pubic bone, right? This is body, and then this is the superior ramus, right? You can see here superior ramus, and this is the inferior ramus, right friends? Now about the body, we had said that the body has a crest, it has a pubic tubercle, and it has surfaces, right? Okay, let us see here first. Here we have the pubic crest, right? This is the pubic crest, as you can see in the video, in the camera. This is the pubic crest. Now then there is a tubercle which is called the pubic tubercle. So this is the pubic tubercle. We are mentioning all these because they have certain importances and they have certain attachments and everything. So this is the pubic tubercle, this is the pubic crest. Now it has three surfaces, right? I had told you that the pubic tubercle, the pubic bone, the body of the pubic bone has three surfaces. One, anterior surface; second, posterior surface or pelvic surface; and then there is medial surface or symphysial surface. So let me show you guys here. This is the, which I'm coloring with green color. This is the pubic surface or the posterior surface or the pelvic surface, right? So then there is an anterior surface. So this is the anterior surface, right friends? And then there is a medial surface. So this will be the medial surface of it, right? So look, medial surface, which is pointed, why? Because this is pointing towards the mid side of the body. So medial surface, this is pointing behind, so this is posterior surface or pelvic surface, and this is pointing anteriorly, so we say this is anterior surface. So the body has what? It has a pubic crest, it has a pubic tubercle, right, we said, and it has three surfaces: posterior, anterior and medial surface. Done. Then there was superior ramus, right? So the superior ramus of the pubic bone has borders and surfaces, right? It has borders and surfaces. So what are those? The first border that it has is, we have written there, that is the superior border, right? The first border is the superior border, this one, which I will color with blue color. So this is the superior border, and this superior border we have written there, it is also known as the pectinal line. So this is the superior border, or it is also known as the pectinal line. Then there was the anterior border, this one, right? So this is the anterior border, or this is also known as the obturator crest. We have written that there in the theory. If you keep your copy in front of you, you will find all of these. So this is the pectinal line or superior border. Then there is the anterior border, which is called the obturator crest, and then there is the inferior border. Yes, there is the inferior border, as you can see here. So it has three borders and three surfaces: the superior border, the anterior border and the inferior border, right friends? Then there were three surfaces, and what are those surfaces? The first surface was the pectinal surface, this one, which I am showing with green color. So this is the pectinal surface of the pubic bone, right? The pectinal surface, as there is the pectinal line and the obturator border. So in between the obturator border and pectinal line, there is the pectinal surface, right? Then the next surface was the pelvic surface. As you can see here, this is the pelvic surface of the pubic bone. So this is the pelvic surface as it is towards the pelvic cavity. That's why we said this is the pelvic surface. And then there was the obturator surface, the down one. Yes, there is the obturator surface, as it is because it is towards the obturator foramen. That's why we said this is the obturator surface, right? So we said that the superior ramus has 3 borders and 3 surfaces: the pectinal border, the inferior border, and the anterior border or obturator border. Then there were 3 surfaces: the pectinal surface, right? Then there pelvic surface, and then there is the obturator surface. So these were the 3 surfaces of the superior ramus. And then the inferior ramus is from the body up to this point. Why? Because from here onward there will be the ramus of the ischial bone. So here we say that this is the inferior ramus of the pubic bone, right friends? So this was the important markings of the pubic bone. Now in the next lecture we will discuss the ischial bone and the important markings, and then we will go towards the attachment of muscles and everything. So friends, if you like the lecture, please share these videos with your friends also, and also invite your friends to our channel, so this very little channel will grow a little bit by the help of you guys. So see you guys in the next lectures. We will see you with other bones. Till then, Allah Hafiz.